Hi, everyone, and welcome to Clinical Solutions What's on Our Minds. My name is Amy Perello, and I'm an Implementation Manager for EBSCO Health. Today, we are celebrating Martin Luther King Jr. Day. Today celebrates the life and legacy of American civil rights activist, thought leader, and Nobel Peace Prize winner, Dr. Martin Luther King Jr. In the spirit of this holiday, today we want to share with you a topic in DynaMed that discusses some of the racial disparities seen in healthcare today. Even if you've used DynaMed, you might not know about our wide variety of quality improvement topics. These provide information aiming to optimize patient care and minimize harmful or unnecessary interventions. There are a variety of different types of quality improvement topics. They will start with an overview or description of the topic being discussed and mention some of the impacts it has on patients' health. Then, you can navigate through the table of contents to learn more about quality measures that can be taken to improve patient care and promote better outcomes. The evidence behind these measures is provided so you can see how they have been successfully used in patient populations. In honor of Martin Luther King Jr. Day, I wanted to highlight a quality improvement topic on racial and ethnic disparities in obstetric and gynecologic care. And while we are discussing this on Martin Luther King Jr. Day, this is relevant information anytime. If you are a clinician, quality improvement officer, or healthcare administrator, you may find it helpful to read more about the racial disparities that exist in this specialty and how they can potentially be addressed. And DynaMed is able to stay current on topics like these by updating them when new evidence is available. So you can read through this article and get a more comprehensive understanding of the research that has been done to examine these racial disparities. For example, what are the contributing factors and how do these disparities manifest themselves here in this particular specialty of obstetric and gynecologic care? You could read more about the social determinants of healthcare or read an article about how insurance coverage and environmental exposures are factors that can contribute to your access to and reception of quality healthcare. So here under insurance coverage, it walks you through how underinsurance is associated with an increased risk of lack of access to care, inability to get regular checkups, delayed diagnosis, and more. It also provides a study showing that Black women in the U.S. report to have higher rates of uninsurance or underinsurance than white women. You can read on to see more of these. For now, let's look at the strategies to reduce disparities. Because as we know, Martin Luther King was certainly a man of action, so let's see what healthcare providers and the industry in general can do to try and reduce the disparities we see. We have recommended strategies from the American College of Obstetricians and Gynecologists. It includes prioritizing reducing disparities in healthcare and raising awareness, promoting research that identifies cultural and structural barriers to care, and tests how effective interventions are that seek to address these barriers. Make sure you are educating patients in a culturally sensitive way. Ask patients about the social determinants of their health that may impact their care and health outcomes, like access to stable housing, safety in the home, and employment conditions. There is also a recommendation listed here under General Care Improvement Strategies that calls for in-person collaboration to learn more about these disparities. It can be really helpful to have an open dialogue and in-person collaboration among different members of patient care teams so that people can recognize their own biases and learn more about the issues that they may not be aware of or have personally experienced. There is a lot more to this article. I wish we had more time to take a deeper dive into it, but if you have a DynaMed subscription, I highly recommend you read it all the way through. There's a lot of great information and recommendations in here to improve patient care for marginalized and underrepresented communities. If you don't have access to DynaMed, you can experience the content in our app using a limited guest access subscription. I want to leave you with a quote from Dr. Martin Luther King Jr. himself. With patient and firm determination, we will press on until every valley of despair is exalted to new peaks of hope, until every mountain of pride and irrationality is made low by the leveling process of humility and compassion, until the rough places of injustice are transformed into a smooth plain of equality of opportunity, and until the crooked places of prejudice are transformed by the straightening process of bright-eyed wisdom. Thank you so much for watching today, and again, happy Martin Luther King Day. We look forward to having you watch more of our videos. We'll be releasing more content soon. If you have any requests or anything you'd like covered in future videos, please click on the link in the description and give us your feedback. If you are a subscriber of DynaMed or any other EBSCO resource and have a question about implementing your resource, learning more about it, or promoting it to your staff, click the link also listed in the description and ask your question. If you are watching this and saying, "Hey, how can I get all these great resources?" use the same link and let us know that you're interested. All right, thank you again and see you next time.